All right. Hello, everyone, and welcome to the research seminar for Berkeley Public Health. I'm Jen Ahern, Associate Dean for Research. I want to remind the students who are here, who are taking this for credit, to sign up in the Google Sheet that Lauren had just posted in the chat. And I think most of you, I see I'm sort of stall while you're all joining audio. I think most of you are connected to audio now. I'm really pleased to introduce our speaker today. Dr. Jason Su is an associate researcher in the Division of Environmental Health Sciences, and he'll be presenting to us today on a project related to vehicle emissions and respiratory disease. So thank you, Jason. We look forward to your talk.
Thank you, Jim, for your introduction. Thank you, Norian, for the invite. So this is a very exciting project. It has been going on for 2 years. Just have it done around 6 months ago. So this one is specific focus on the impacts of vehicles emissions, and the impact on the outcome is also very interesting. It's not a typical outcome, but it's respiratory disease symptoms throughout California. I will get more details once I do go to the health outcome part. So for this study, because it's about vehicle emissions, so we basically classified the entire California into 3 location categories. One is goods movement corridors. That's 500 meters of highways that permit truck, heavy-duty trucks. So those are called GMC, and also the NGMC is non-goods movement corridors. Those are the collecting roadways. You see on the right side, those blue ones. So 300 meters from collecting roadways or 500 meters from highways, those highways but do not allow heavy-duty trucks, like a part of the 580 in East Bay. So those are non-goods movement corridors. And all the other ones, we classify them as control areas. So, for today's presentation, I will only have two major parts: how to develop daily air pollution models and surfaces for the 3 criteria pollutants. For us to develop daily, not monthly or annual or multi-year models or surfaces, is due to the outcome. Outcome is rescue medication use that's also at a day or sub-daily. So we need to match exposure with health outcome. But first, go to the exposure analysis part. So I will introduce the basic concept of non-use regression model, because this is the basis of our exposure modeling. I will introduce what are the factors that impact merger concentrations. Those are the predictors. But also another important factor is how far or the impact of the surrounding environment on the merger concentrations. So that's buffer statistics. So once we do this, have a lot of predictors and a lot of buffers. So there are around 2,000 to 3,000 predictors. That's too much to have high collinearity between the predictors. So we need to apply the data reduction strategy. Then after that, we develop a model through V-fold cross-validation techniques. I will introduce that in greater detail when we get overview. I will compare what the model we develop with other models and also how to assess performance, and also some of the modeling results for the 3 criteria pollutants. So this is the first part for exposure modeling. So for a non-use regression model, so the basic concept is this: you have those dots over there, like those dots are the locations or air quality monitors. So the merger concentrations, here it becomes a Y, so major concentrations. So we try to find the surrounding non-use, non-cover, and the meteorological conditions and other factors that might impact merger concentrations. Those are all the predicted, it's called the X. So you want to use the X to predict Y as accurate as possible. Then once this model is built, then you can use it to locations or any location in your study region that it does not have air quality monitors. Right? So that's the whole point. So so the first thing, talk about the response variable. Okay, for like over here, I used basically the two types of monitors. Not only two, it's 3 types of monitors. So for like show you over here, you have California Air Resources Board carb regulatory monitors for NO2. In the middle, you have the Ogawa air quality monitors. Those are the ones we have throughout our research years. So more than 15 years of research, so throughout California. And also we have another type of monitoring that goes through the Google streetcar air monitoring. So they are very densely monitored. So you can see they have at Central Valley, San Francisco Bay, and also the LA region. So these are 3 types of air quality monitors. So these are all the response variable. We need a way to integrate them into together. So I will first, so it's just show you how many monitors over here for carb. So Cal EPA is around 106 to 113 throughout our study period. And the NO2 saturation monitor, that's through our historical research, we have for Alameda County, LA, and also Sacramento. So this the with size ranging from 45 to 64. So this are saturation monitoring, and also the Google streetcar mobile monitoring that runs through from 2016 to 2019. So I have in those measurements in San Francisco Bay, Central King Valley, and also SoCal, Los Angeles. As I showed you before, for those ones, you can see for the Google streetcar air monitoring, they're so dense. Every 4-5 seconds, they have one measurement. So you won't use all of those data for you to as a response variable to model, because it's a highly collinear spatially. So what we did, we select 4 regions or sub-regions, one Alameda, Contra Costa, LA, Central Valley, and also San Francisco, San Mateo. For each location, we select 150 road segments with at least 100 measurements of the by Google streetcar monitoring. So we select each region, select 150, but we also further select around 50 of them in those good moment corridors, around 50 in non-good moment corridors, and around 50 in those control areas. This is done through a location allocation algorithm to reduce spatial autocorrelation or spatial collinearity between the locations. The basic idea is, okay, so on the top left, you have the those red dots. Those are all Google streetcar mobile monitoring data. We want to select 150 decorrelated. So but we also want to select those ones near residential areas. So that's top right figure. and then we used the roughly previous surface, because once we select locations we want to select, those ones have high change or variation of concentration from high to low, so then there would be a representative of the exposure scope. Then after that, through the location allocation algorithm, we selected around 150 sites for East Bay. We did the same thing for LA, for Central Valley, and also for San Francisco, San Mateo. So this get us to around 150 for each sub-region. Remember, those are response variables, okay? But we need to make some temporary adjustments. So for the fixed site saturation monitoring data through Ogawa, we have done throughout the years, so every 2-week measurements. So we need to calibrate, use the government monitoring data to get it to daily. And for Google Streetcar monitoring data, there are for the Google Streetcar monitoring, they are operating in a way so that for each location, like you say, okay, in East Bay, right? So start always same time, the same location. That means if that location you went over there is the peak hour, then merge that day always high. So that's not what you wanted. But because some of the time periods of low at that location were not merged. So we use the trending algorithm to get the daily average mean. So those ones made adjustments. So not only those adjustments we made, but we also calibrated, like the Google Streetcar measurements provided by Google. So basically have the calibration vehicles before they go out to calibrate and the measurements compared to regular monitors. For us, for the saturation monitoring data, we also did calibration with government monitors every 2 weeks before we further disaggregate them back to daily. So in this way, all the 3 types of monitoring data, I mean, those data from regulatory monitoring, our fixed site saturation monitoring, and the Google Streetcar air quality monitoring, the data that can be comparable, so can be integrated into a big data frame. So those are the response variables. Okay, as I said, non-user regression model, a very important part is how to have predictors, so you can predict concentrations at those monitoring locations, then you can apply them to any location to make a prediction of air quality concentrations, right? So that's the whole point for exposure assessment. For the predictors, so we have those ones with very high spatial resolution. We create buffers. Those ones including the daily traffic, non-use variable. Like you will say, okay, if you it's industrial or commercial non-use will have high impact on concentration. You have parks, then those ones are sinks, they're not a source, then have lower concentration. And non-covered too, not only non-use, non-covered, if you have the vegetated areas that have most likely lower concentrations. But if your non-covered is highly developed land, like those include roadways and high densely populated areas, those are the positive impact on the concentrations. For those high resolution data, we create buffers, normally from 50 to 5 kilometers at an interval of 50. That means one predictor will have 100 corresponding predictors. Over here, you might think that's too much, okay? But that's how we do it, because in that way, we will be able to find optimal distance of impact. I would discuss later how to reduce the number of predictors. So the predictors, so for one is buffered, right? Some of them is a non-buffered. So this includes the meteorological conditions like temperature, relative humidity, wind speed, pressure, all have impact on the merged concentrations, and also the vegetation index change, like every 2 week of vegetation change will have impact on the absorption of the pollutants, and also some of the indirect measurements of the concentration. There are not responsible variable instead. They are treated as predictors. Those are remote sensing data, mostly like the aerosol optical depth AOD data, indirect measure of PM 2.5, or you have also monitoring instrument for NO2 and O3. Those are all indirect measurements of the concentrations. So we use them as a predictor because they have the coverage for any locations without any limitation. So, and also other non-buffered variables, we include them. Like you say, okay, if you're high elevation, you might have a lower concentration. You're very close to the coast, you might have lower concentration. But if you're very close to the ports, you might have higher concentrations. So those are all the predictors. We try to find all the predictors that might have comprehensive understanding of the impact of concentration merged of locations of interest. So now I'm going into more details now. First one is the traffic. Traffic from Caltrain PEMS, they have the daily traffic data. But they only have daily traffic data for around 5% of road segments. Okay, this is not a 5% of highways. That's always might be wrong. So we basically create all the major roadways and highways with create 50 meter length segments. So to see what's the proportion being covered or can be calculated for the traffic. So overall, only 5% of the highway road segments, highway and major road segments have traffic. So, but also the because when Caltrain measures traffic, they have the information for those locations, more than 40,000 locations. So they have the route information, county information, district information, route type, and the time, and also the traffic, right? So for us, we always use the closest distance for those non-measurement road segments to be assigned to the closest one with the measurements. So based on criteria, so first you try to match route, county, district, route type, and the day, everything. But if those ones cannot match, assume like you cannot match the county, then you will go outside county. But in this way, if you cannot match in the same day, at most we go outside one day. But you always trying to match based on certain route type. We will never change route type. That means if we are highway, you know, always a highway, you won't be matched from major roadways or the local roadways. And so in this way, we extend traffic from those around 5% of the highway road segments to all the California highways and major roadways. So that's one way of traffic. But once you've done that, so we also calculated the traffic for around or surrounding all those government or fixed saturation and also Google Street Car monitoring data. So we created buffers. Those from 50 to 1 kilometer and the interval 50, that's 100. So those are basically for traffic, you have 100 predictors and distance and a different distance. So that's for traffic, daily traffic. For land cover, we use 2016 land cover. Like I said, so it's basically the source or sink concept, right? If you are highly developed, so you have high impact on the concentration. If you are open water, your forest or shrubs and grasslands, those are all sinks. They should have lower concentrations. So we use this for every major land cover. We also create one land cover. Okay, create the buffer distance from 50 to 5 kilometer at an interval of 50. So over here, you can see the will have a lot of, because it have a lot of non-cover types. Each non-cover type, you can create 100 predictors. So there are a lot of predictors over here now. And the 90 use, so like commercial and the industries might have the huge impact on the concentrations, and also the agriculture, government. So the like UC Berkeley, and those are government ones might, because they might have lower concentrations. So we also built the buffers for each 90 use type. So from 50 to 5 kilometer at the interval of 100, at the interval of 50, so each 90 use type will have 100 predictors. So we'll keep going first. Okay. For the this now comes to the remote sensing data now. Vegetation has a huge impact on the concentration, right? So once you have higher vegetated areas that have lower concentration because higher absorption of the air pollutants. So we have 2 weak vegetation index, and also the meteorological conditions, as I said before, have a huge impact on the measured concentrations, like temperature, relative humidity, wind speed, pressure, all have the impact. So for this ones and this ones, we generated through the Google Earth engine. So we wrote some JavaScript codes to extract the underlying conditions surrounding the measured concentrations. Other predictors, like I said before, if you are higher elevation, you have lower concentrations. You are closer to the highway, of course, you're going to have greater impact of traffic and then high concentrations. And the distance to cargo or ports, you will have great impact, right? If you are shorter distance. All these things are non-buffered, but have impact on the measured concentrations. Okay, now, once we generated all of those predictors and also the buffers, right, we have around 2,000 to 3,000 predictors. Those are far way too much, and the majority are very collinear. How to deal with that? So basically, we have the data reduction strategy before we do any model. So basically, we use the measured concentrations, right? You also put all the predictors together, choose the predictor has the highest correlation with the measured concentration. So you select that predictor, okay? So maintain that predictor in the model and use that predictor selected, okay, predictor to make a correlation coefficient with all of the predictors not selected. And when for all of those not selected predictors with a correlation of the selected predictors, if the correlation coefficient is higher than 90%, we remove them. So then, okay, we got the first selected, we got those ones has less correlation, but still maintained, right? So we just keep selecting the second highest correlation of those selected ones, and do the same thing to get rid of all the predictors that has a higher correlation, less than greater than 0.9, with the second selected predictor. So in this way, we normally could reduce the number of predictors from 2,000 to 3,000 to around 200. Most times they're getting less than 200, but close to 200. Now 200 still is too much. Some of them still have some type of collinear. So then we use the DSA. So it's the deletion, substitution, addition algorithm through the V-fold cross-validation technique to select the best model. So like for NO2 model, we have the Cal EPA regulatory monitoring data, have our fixed site saturation monitoring data, and also the Google Streetcar mobile monitoring data. So for them to do the DSA model, we separate each type of monitoring data into 10 folds equally. Like government monitoring data, we separate them 10 equal parts, and also the fixed side and also the Google Streetcar all separate 10 equal folds, and then merge them onto a big 10-fold data. So now we have 10 folds of data, right? So for us, how to do it through the DSA is, okay, we use the 9 folds to build a model, and use the 1 fold to use as a validation. So we'll just keep doing this 10 times. So each time 1 fold will be used as validation. So we select the overall with the minimum or least cross validation error as the model. But this also for us, when we're doing the selection process, we also specify maximum number of the predictors in the model. So we normally specify maximum around 15. So it will never go beyond 16. But for the DSA model, it does not start from 15 right away. Is because the DSA, that means deletion, substitution, addition. So basically we start, okay, you have the response variable. We start with 1 predictor. Right? So it's placing first, you have addition, you add 1. For all those, assuming you have 200 predictors, you only use 1 predictor. You find the best predictor that has the least cross-validation error based on the 10-fold cross-validation. Right? So you go this way, 1 predictor, 2 predictors, all the way up to 15 predictors. So basically, it develop a series of optimized models. So this is how our model was developed. You might have questions. This is kind of very high introductory, high level, is very technical. You could ask questions later if we still have enough time. So for non-use regression models and the performance assessment, for the models we develop, we have daily models, but most of the literature research, they have multi-year annual models because the outcome are annual or multi-year. For the spatial resolution, for us, even though we are doing for the entire California, we still, when we build the model, we still have a spatial resolution of 30 meters. But for the storage of space, we try to reduce that amount, so we use 100 meters. So that's significant, very, very high spatial resolution. And also to find the optimal distance of impact that buffers, most of the research could not do as what we do. So only you choose 250, 500, 1 kilometer, or 2 kilometer, around 4 or 5 buffers. But for us, we had an algorithm to calculate the impact or distance from 50 to 5 kilometers with an interval of 50. Data integration. So as I said, introduced you before, those are for NO2 modeling. We integrate government EPA regulatory monitoring and our fixed site saturation monitoring, and also Google Streetcar mobile monitoring data. Most of the research in literature only use 1 type of monitoring data. And also the model types. So we using the linear mix models because one location might have is daily, right? Have multiple measurements. So we use a linear mix model. And the performance assessment, like I showed you before, we use V-fold cross validation. This is the most robust validations that totally use the data out of sample, out of model. So do not other methods used, that are not as stringent as what we did. Now to show you some of the modeling results. So this is the daily NO2 model. The power adjusted R square is around 0.80 or 80%. So we use 15 predicted selected. This example of daily and monthly and annual NO2 concentrations of 100 meter resolution. You need to zoom in to see the details. This because this is so big across the entire California, since not that dramatic. Okay, we also did that's for NO2, right? We also did for PM 2.5. The PM 2.5, we only used government monitoring data. Google Street Car do have the particle monitoring data, but they use the bind. So the bind each size, so we could not know, we could not aggregate them to the PM 2.5 proportion. So that's why we only use the government size. But that's still enough. It's around 111 to 117 size. That's locations, right? You plus 8 years of the data. So this is the Cal EPA monitoring data. We use that and build similar models. So the adjusted R square is 0.65. So this is the daily, monthly, and annual concentrations for year 2012 for PM 2.5. So we also did the same thing for ozone. Ozone have measurements, a lot of measurements from government regulatory monitors, but also we have done the saturation monitoring in LA, in Alameda, so that's East Bay, and also in Central Valley. So this is from Cal EPA, from Sacramento, but also from LA and also the East Bay area. So it's the same thing for Google Street Car mobile monitoring data. We have to use location annotation algorithms to select subsets of the data for each sub-region, so they are not spatially collinear. So once we incorporate the 3 types of ozone monitoring data, we developed LUR daily model for ozone, have the adjusted R squared to 94%. So that's the highest one we got. So this is an example of daily, monthly, and annual concentrations for year 2012 for ozone. So basically, this part of 1 exposure assessment for the entire California for the study period. So they are relatively high. If we build daily surfaces at this high resolution, is not that typical. Then we use the models to build the surfaces. As I said before, to save storage space, we didn't use 30-meter resolution surfaces. We used 100-meter spatial resolution for exposure assessment. So, but 100-meter still reflects the small area variation, so can be easily differentiate those. We could say vulnerable community from those non-vulnerable communities. That's the first part. The exposure assessment development of daily air pollution models and surfaces for NO2, PM 2.5, and ozone. Now, come to the second part. It's the propeller house data. That's the house data we use inside a project. The house outcome is daily number of rescue medication use events. So Dr. Meredith Barrett, she was supposed to be here today, but she is sick. So I will try my best to explain what the data set is. But the house outcome analysis was done by UC Berkeley, so we are okay with that. Only the data set is provided by Peripheral House, or called right now called Resume, because that's the parent company. So Peripheral House data. So basically, they have those. And some of you might know, some of you might not. So have those rescue inhalers, so as asthma or COPD patients use. And then the Peripheral House is used to either sensor to the rescue inhalers. Once the patient press the button or use the rescue inhaler, and then the information is automatically triggered, connected to your smartphone, and that smartphone also transfer the information to the server through 1 month or 2 months of activities. That patient's information will be displayed in a dashboard. So for the monitor a patient's symptoms, we are not concerned about the far right part, because that's what Peripheral House do. For us, more interested in other things. So before I go into that, so the Peripheral House sensors, they say, are compatible with 90% of the rescue inhaler sensors. So these are the ones that are compatible with. So, but for us, the most important part, the once the patient use rescue inhaler, so it records the location of that patient through the paired smartphone, right? Not only those times they record the location, but also have the every 4 hours, the sensors also try to contact the paired smartphones to report battery life. Report battery life is not that important for us, but for our researchers, important is the location. So once you have a few years of a few days of exposure, or a few days using the rescue inhalers, it doesn't matter where you are. So they will know the exactly locations. So the patient can kind of identify the activity space a patient is throughout the history. So for the rescue inhaler, is called, the official name is called Short-Acting Beta Agonist, called SABA. So SABA use. So the SABA use or rescue inhalers are normally used when people feel shortness of breath, coughing, wheeze. So those are, so we use those the triggers of the rescue inhaler use as an outcome for our study. So this, for the patients, for the California, we have around 3,400, mainly asthma. Majority of them are females. So the mean age is 38. So we also have those the baseline impact. How to do the baseline impact? So when a patient registers for the system or for using the smart sensors, so every patient is measured the asthma control test score if there are asthma patients, or COPD assessment test if there are COPD patients. So we just classify them as if no impact, medium, high, or very high impact. So those are the baseline conditions based on the personal conditions. So we want to control for that in our modeling process. For the outcome is, okay, because a patient might have multiple, and we call it heartbeats. Heartbeats are the time when the patient does not use rescue medication, but that also triggered the location recording due to the fact to want to report the battery life. So those are the locations we are still interested. So in one day, a patient might have multiple locations of heartbeats, and also might have multiple locations or rescue medication use. So for us, we use all the locations in a day to match the exposure surfaces we build. So and then average all the exposures for all the locations have in a day, get the mean exposure. Now that's the mean exposure. So mean exposure for NO2, PM2.5, and ozones, right? That's X. That's for the exposure of interest for health outcome is if a patient use one rescue medication and one SABA use in one location, another SABA use another location, and then we just add all the SABA use in the day to form the outcome. So basically, daily total number of rescue medication use. So can have two. One's total use, another one is the puffs. So this is how we get to the exposure and outcome. Right. So for the days, so for the study, mean a day is around 4 puffs for a person, but rescue events around half of them. And they classify rescue events based on the time interval of puffs. If you have one patient inhaled how many puffs, but another one inhaled within 2 minutes, then those will be treated as different puffs, but will be treated if they're within 2 minutes, then will be treated as the same rescue event. So that's why the rescue events are smaller than puffs. These are the distribution of rescue medication use puffs and the events. So puffs are most time less than 20, and the events most time less than 5. For the exposure, because not every day a patient has rescue medication use, right? But they do have heartbeats. That means the sensors try to pair with smartphone to report battery life and also location. So they have more more days with exposure. So the exposure days is more than 500,000. This is what we for the study. Over here, we all have a weekly risk. So why we do that? Because some experts claim that you have the exposure impact, even though we have the baseline controls, right? We control the baseline impact of condition, but the condition of person or patient might change during the course, so they might get even worse. So for that thing, we also create weekly risk. So that means if you have a SABA use, you have every day, then that might be air pollution, but might not be air pollution due to personal conditions. So we used weekly number of SABA use to further control for confounding. And that might over control, okay? But for strict statistical way, we need to do it that way because we want to get rid of impact of personal conditions and the outcome. We only wanted to see or identify the effect of air pollution and outcome. So this is how the model is developed. So you have the CSI is the concentration or exposure, and the Y is the number of rescue medication used a day, either events or puffs. So we have PSI is the personal conditions. O is other like weather, right? And also you weekly risk. So those are all other. But also this is the linear mix model. So we have gamma S. But we didn't use the typical linear mix model. We use GLMMTMB. So it's a generalized linear mix model with template model builder. So that one basically taking consideration of the zero inflation. You can see because we have a lot. See, you have so many days of exposures, right? But eventually you go to events, it's much less. So there are a lot of 0 days of outcome. So we need control for that. But also the outcome is kind of data. Basically, sometimes we assume distribution, Poisson distribution or whatever, and then if it has the over dispersion, so we need control for that too. So that's why we use a GLM and TMB to build the model. That's for this one, it's individual pollutant model, but we also wanted to build a model that integrates 3 pollutant impacts. So that's NO2, PM2.5, and ozone. So that's beta 1.1, beta 1.2, and beta 1.3. So we wanted to see if we could incorporate those 2 for model. So we first diagnostics, we identified for sure they have 0 inflation, but we've identified from the dispersion model, the dispersion is not significant. It's 0.9. It's less than 1.2 normally. So we consider they could use Poisson, but we need to consider 0 inflation. So for us to, if we wanted to put PM2.5 and O2 and O3 into the same model to model the outcome, we need to make sure they are not have strong, significant multicollinearity. So we went through the variance inflection factor. So the variance inflation factor found the VRF are all less than 2.5. So we could put them together in our simultaneous exposure model. So now this model is only for impact of NO2 after comprehensive control or all the confining. So you have temperature, age, sex, control plan, and also baseline impact with then the weekly impact. So we find that the NO2 is significant associated with the outcome. PM2.5 is then 2. Ozone also has significant impact. No, ozone is not. Ozone itself is not significant correlated. Okay, but once we put all of them together, NO2, O3, and PM2.5 are found significant associated and positively with the rescue medication use. So over here, it shows the what's basically the actual value I extract from the models. This is based on the per unit increase. Like NO2 is per ppb, PM2.5 is per microgram per cubic meter. Ozone is also per ppb. Resume, they wanted to see that effect, but as a researcher, we normally use the standardized, right? Like the NO2 would say 10 ppb, PM2.5, 10 microgram per cubic meter, and also for the ozone, the per 30 ppb, what's the impact? So we find the impact would be 2.5 for NO2, 9.1 for PM2.5, and 17.2 for ozone, based on the normalized or standardized response. So this, we also did another model, very interesting, as a random forest model. We just wanted to see if random forest model can get similar results, because the random forest model, the machine learning algorithms that do not assume any underlying data structure. And it's also, even though it could be have model overfit, but it's resistant. So to model overfit and multicollinearity and interactions, especially the interactions, normally we do not do that. Then the random forest model might internally have those interactions. So so we've used personalized partial dependence plots run the random forest modeling. The random forest modeling used the same predictors as we used for the GLMMTMB, so the final 15 predictors. So we found still have significant impact, positive impact of the 3 pollutants. So this is the conclusion of the research. So we basically get tons of data sources for our air pollution exposure modeling. We had, for this one, we used, I think, 32 terabytes of data to collection data source and also generated exposure surfaces. We also integrated government monitoring data, saturation monitoring data from our research, and also Google Street Count monitoring data. So we generate high pollution surfaces for those 3 pollutants throughout California for the study region, basically from 2012 to 2019. So we identified what I like most. I've been doing environmental health research for a long time now. Most like for the per house data is that so do not assume, like more than 90% of research we have been doing is assume where the exposure is at home, right? Except those doing occupational studies, most of them assume exposure at home, but that's not true. For rescue medication use, basically, whenever a patient uses rescue medication or the heartbeats locations, right? So we just summarize what they are and average the exposure for a day. So that's basically after you've gone through a few months to follow a patient, you basically can identify the exposure space because you identify the space-time activity. So that's a very interesting part of the health outcome. COB was also very satisfactory with what we have been doing. Say, this might be rescue medication use, might be a proxy as a new health endpoint for COB's health analysis in regulatory process. So that's the only one of the COB projects. So we have a series of COB projects going. So the expansion studies, there's another one. So the one I introduced to you is one, it's finished close to 1 year ago. Now, the second one is the not a vehicle sources, only focus on train operations and operations of port vehicles to see the impact. In Southern California, we use the same, basically the same health outcome data. That's rescue medication use. This one is almost done. We have until May 15 to end the project. So we will find a significant impact of port vehicle operations and also operations of trains around railways have impact on the rescue medication use. And also the one I have been doing now with UCLA Biara rates. So it's a series, a lot of health outcome now. It's a preterm birth, no base weight, childhood autism, Parkinson's disease, Alzheimer's disease. And the air pollution, we use the same air pollution, but we extend back further, going to from 1990 to 2019. And the one I have been doing showed you is from 2012 to 2019. And that one is still going because that one has so much longer exposure. We have a huge challenge in the storage space and the surfaces, and also there's so many health outcomes. So we'll probably need to extend the 2-year contract through no cost extension. But that one is already planned at the start. COB was saying probably this needs to be done in 3 years, not 2 years, because too much information and too much stuff to be done. And we also have the right now COB is also funding us the metabolic health outcome for California residents using similar exposures we have been doing. So this one will likely start in May. It was supposed to start in March, but UC Berkeley was so so crammed and a lot of stuff to do. So that approval by UC Berkeley was delayed, and also so the CARB will delay that approval, and we'll start that project to May 1st. For metabolic health outcomes, so we basically want to identify the impact of air pollution on incidence of diabetes, diabetes-related elevated hospitalizations, and diabetes-related death. So that's the third, the fourth CARB project. Because the fifth CARB project is the impact of air pollution. We use similar air pollution to identify the life expectancies across a long period of time. So this one, we're still doing the process of proposal. It will be crowdfunded, maybe be in June or something. So I really appreciate all these projects, CARB projects, are provided with a huge help from sponsor project office like Lauren Golston and Raymond Fund. Raymond Fund is super effective in dealing with proposals. The CARB has a tendency to going back and forth. We like to improve our proposal, but this also put a lot of pressure on SPO to help us. But we have gone through this a lot of times and a lot of work, but it's worth it. So as I said, the funding is through California Air Resource Board. I have a lot of collaborators for all of these contracts. So John Bones is one. John Bones is basically professor at UC Berkeley and also UCSF. He is my academic advisor and grateful for his help, always very kind person. And also Mike Dredd from UCLA, Robert McConnell from USC, Sadi Kendi from UHCMC, that's University Hospital Cleveland Medical Center. We're doing for the diabetes related, right? The Beta race, that's one who is from UCLA. Sadie is from NCIRE, is very close to us. Actually, it's the Northern California Institute Research and Education, is affiliate of UCSF. He will collaborate with us as Josh Apathy from UCB and the life expectancy, and Meredith Barrett. She is a vice president in research from Resume and Porter House for the first and second project we have been doing.
Thanks so much, Jason.
That's
thank
it.
you. Yeah, thank you so much. I really appreciate it. And unfortunately, we're out of time to take questions, but people can reach out to you directly with questions. But thank you so much for sharing your work. And you have so much interesting data. And it's really amazing to see how you can combine it all and do all the modeling. So I really, really enjoyed learning about it. Thank you. Thank you so much. And thanks, everyone, for joining.
Thank you for your support.
Yeah. Thank you. Take care, everybody. Have
Thanks,
a good
Jason.
day. Thank you.
Bye.
Bye-bye.
Bye-bye.